All right. Well, again, good morning, everyone. We get ready to get started. Thank you. And you for being here. Amen. And welcome this morning to Weighty Heart Matters. All right, so I got everybody muted. Amen. I want to just open briefly with a word of prayer. And thank you for joining us this morning in this critical conversation that we're having. And today, our topic is survivors. We're going to talk about people who have survived heart trouble, heart issues. We're going to talk about survivors. And that's very, very important. It's critical. And there we see Miss Murray Stoops highlighted one of our survivors, and she's going to share with us today her testimony. And so we got some good stuff for today, and we want you just prepare yourselves. So let's go in the word of prayer, and then we're going to introduce everyone that's here. Amen. Let's just go into a word of prayer. Gracious God, our Father, Master, we thank you now for your loving kindness and your tender mercy. God, we thank you for giving us a mind to learn more about these bodies that you've given us. We thank you today for Dr. Gigi, God, with all of her wisdom and skill and knowledge. Come on today, God, and thinking not robbery to help us take better care of ourselves. Bless us this day in Jesus' name. Amen and amen. All right, beloved, and let me see. All right, there's Pastor Carla. I don't know why. Hey, Pastor Carla.
Hello, everyone.
Hello, love. I see Pastor Hillary there. She's still hiding out. Hello.
Good morning, Bishop. Good morning, everybody.
Good morning. She's muted. You gotta unmute. They didn't hear you, Pastor Hillary.
I'm so sorry. Good morning, everybody. Good morning, Bishop. Good morning, panelists. It's so good to be here, and I am ready to hear everything. I am moving around, so that's why my video is. I have closed out my picture, so I won't disturb the live recording. But I am here and ready to hear everything from everybody.
Do you all hear feedback? No, you don't hear feedback? Okay, great. That's just mine then. Okay, all right. Well, okay, good morning, lovelies. And we have other people who have registered. They're going to miss out on their prizes. Amen. So we're so glad today to have all of you here with us. And of course, my twin, my sister. We are two from another mother. Amen. She is the incomparable Dr. Jahan El Bayume, but we call her Dr. Gigi. And so we're so grateful today that she, thought enough of us today. I mean, because she's on CNN, she's everywhere, but she is just as invested as we are in making sure we stay healthy, remain healthy, and optimize our health as much as we can when we're suffering with chronic diseases. And I could go on a long list about her. Most of you know me, you already know her. This is my sister. But we're so glad to have her today. Good morning, Dr. Gigi.
Good morning, my twin. It is so good to see everybody, and I'm delighted to be sharing this panel with these beautiful, smart, lovely women. So can't wait to talk and to educate. And I'm also a learner. I'm always a student. So thank you for inviting me, Bishop Webb.
Yes, it's an honor. It's an honor. Because as I was praying, the Lord told me, of course, we did one last year, Weighty Heart Matters. And the Lord told me, he said, do it again this year because you all need to be educated. And we got to stop just hiding behind the word and hiding behind the Bible, but we got to do better with this one body that God gave us. And recently, Dr. Gigi, and to all our viewers and our panelists here, when God gave it to me, we're hearing of so many deaths. We're hearing of so many deaths due to cardiac arrest, due to heart attacks. And it's just so disheartening. So today, we're going to talk about that. We're going to talk about that. And so I want to start out today. We have our panelists today, Mrs. Mary Stoops, and she don't look like what she's been through. That's for certain. Doesn't look like what she's been through. And so we're going to start first with stories of survivors. We have one of our survivors. She'll be coming on. She's in Hawaii. So she's going to join us all the way from Hawaii. But this morning, I want to highlight Sister Mary Stoops. Miss Mary Stoops is one who has known me forever. She's my sister too. Amen. She's my sister too. But you know, God just did something with us, and thank God. But good morning, Mrs. Stoops. She got
Good morning. Good morning. I got it.
All right.
Good
All
morning.
right. Good morning. We're glad to see you. We're glad to see you. So, Mrs. Stoops, I want to start out with you because I think sometimes when we hear people's testimony and how people survive, tell us about your story.
Okay, my story, long story. June 29th of 2017, I was down in Greensboro, North Carolina. Matter of fact, I was down there helping my child out who was sick and ended up having to have a triple bypass while I was down there helping my child out. Okay, didn't stop there. After I came back to DC so I could be close to getting cardiologist appointments and stuff because my child wasn't able to take me to those appointments. So I came back to DC, and that was in June. October, lost my child to complications from diabetes. And I just look at it as God just made a way for me, because God knows if I not had that triple bypass, what would have happened for me to lose my first child like that. So it was like I had to just look at it. It was a way of God preparing my heart to accept what had just 3 months later lost my child. But it didn't stop there. After I buried my child,
Wait a minute, Ms. Stoops, wait a minute. You're going a little too fast. I want you to back up. With you go to see your daughter.
Yes.
Who has diabetes.
Yes.
Did you have any signs of any heart trouble?
No signs of any heart trouble. None. Okay. 2 weeks before that, I went to the emergency room and they said I had bronchitis. I was having problems breathing, but they said it was bronchitis. Matter of fact, both me and my child ended up in the hospital at the same time. And then 2 days upon being in the hospital, I found out that I had 82% block of my main arteries blocked.
You had 82%?
82%.
So, okay, wait a minute. Let us follow this because we need to hear this. I mean, things like this can happen to us. And then we're going to get Dr. Gigi to jump in as well. You go to the doctor. You think you have bronchitis. They treat you for bronchitis.
Right.
Then 2 weeks later, you find out 82% of your heart is blocked.
They said it was so many small branches that were blocked. There was no way that they was going to be able to do a stent for each one of those small branches. But I had to go in, 2 days after I got in there to do this emergency triple bypass.
Okay, okay, hold for 1 second, because I want to bring Dr. Gigi in here, because I'm gonna ask the question I know all of us are thinking, because that gets kind of scary. Because we try to figure out, Dr. Gigi, now, how can they miss that?
So they can miss it for a couple of reasons. First and foremost, Ms. Stooks is an African-American woman. And we know that the care that African-Americans in general get is suboptimal. We know that there are big disparities. There is what I call the medical apartheid system. And so complaints tend to be, and this is just not me talking, this is backed up by research. The second thing is that women usually present like men, usually have chest pain, but there is a larger percentage that will present in what we call an atypical fashion. What does that mean? So instead of having the classic chest pain, chest tightness, chest heaviness, there may be more symptoms of heartburn, of shortness of breath, of fatigue. So I actually have some questions for you, Ms. Stooks. Do you have diabetes yourself?
Yes, I was diagnosed with type 2 diabetes at the age 43.
Oh my, okay. So diabetes is a very strong reason for people to present in different ways. So people with diabetes don't usually present with chest pain. They tend to present more with the heartburn or the shortness of breath. Okay. And so because physicians may not necessarily know that, number one, and because you're African American, you have to sort of be very specific. And this is what this whole educational session is about. I know that I have diabetes. I know that I may have a trouble with my heart and present in a different way. So please do an EKG. Please do the test that you would normally do for somebody presenting with heart trouble. I would also say that because you've had diabetes for so long, anybody in the audience has had diabetes for such a long time, you should really have a cardiologist, because diabetes and heart disease go together. Diabetes is a strong risk factor for heart disease. Now, could it be that you really had bronchitis and that the heart disease, the heart manifestations were later? It could be, because any stress, including the stress of your child being ill, we know that stress plays a role. So how many of us have heard of a member of a couple that have been married for decades and decades, and one passes, and then the next one will pass, in 2 weeks? It's a broken heart, but really there are changes with your heart. I'm just going to come back to one more thing and then turn it over. So I just want to sort of educate everybody about the heart, because the heart is really 4 systems. There are the blood vessels that nourish the heart, and there are 3 main arteries. So your left main, which is the basic blood vessel that supports the muscle of the heart, had 82% blockage. They call that the widowmaker. And with people who have, because it's just, if that gets completely blocked, you could die immediately. The other thing which is consistent with your diabetes is that those small branches, that tends to be more with diabetes. Okay. So that's one system. The second system are the valves that open and shut and allow the heart to fill with blood that can then go to the rest of the body. Then, of course, there's the muscle, and we can talk about the different diseases that affect each of those. So if there's a problem with the pump, either because there's been a previous heart attack or things like COVID can cause inflammation of the heart, that can be affected. And finally, there's the electrical system of the heart. And the electrical system, you sometimes will see that as people get older, they're just like with wires, the wires get frayed, right? And you have to replace them. So sometimes you see older people with pacemakers. That's because part of their electrical system is not working. So it just helps to know what part of the system is impacted. So for you, what I would like to know is, okay, you had this blockage and it's been taken care of for the bypass with the bypass. Has that impacted the function of your heart, the heart muscle?
Yes, it has. I went to the cardiologist 2 months ago, and he said that my heart was 52% better than what it was back then. It was working 52%. And also, when I had the surgery, they told me I had a leaky heart valve. But once they did the bypass, it closed up the, yeah.
Well, thank God. And what you just mentioned and shared your experience with us about is that it shows when you have an immediate shock to the heart, we call that stunned muscle. So there is recovery, especially as you get blood flow into the heart, then it can recover, which it did.
Yes.
So thank God for
Yeah,
that.
thank God.
How are you feeling now?
I'm feeling great.
You look great.
Complaints. Thank you.
So Dr. Gigi, because I'm asking a question, I know all us women thinking, because that gets kind of scary. Now, she goes for bronchitis. What kind of, I know we do diagnostic tests, what kind of diagnostics should we have advocated for to maybe even see that there was some type of heart issue, as opposed to them, because a lot of times as women, we got so much going on, we feel bad, our chest sometimes hurt, sometimes we're overwhelmed, we're tired. She goes because she feels she got bronchitis, because I know a lot of times, especially with me, having asthma, how can we advocate for ourselves when we go to the doctor? What are we supposed to say? What should they be checking?
So first of all, when you have diabetes, you have to realize that you are at high risk for heart disease.
But suppose you don't have diabetes.
Okay, well, another thing that puts you at high risk is your age. So the number one risk factor for heart disease is age. So the older you get, the more likely you're at higher risk, right? So what are the risk factors for heart disease? Age.
Does menopause
Yes.
increase the risk?
I was just gonna get to that. Yes, ma'am. So age, diabetes, certain autoimmune conditions like rheumatoid arthritis and lupus, being on steroids. For men, their heart disease will tend to manifest earlier. We're about 10 years behind because of the protective effects of estrogen. So after we go through menopause, our risk goes up. We know that smoking is a big one. And we should include all types of smoking, right? Because people think that weed is okay. All types of smoking, including pipe and cigars and cigarettes, of course. And then there is also high blood pressure. Okay. So those can affect what we call sort of the blood vessels. There are other conditions that can affect the other systems that I mentioned. But when we're talking about a heart attack or heart disease that Ms. Tukes had, those are the traditional risk factors. And I should say also cocaine use. So once you are post-menopause, your risk is the same as men. So for women,
how should we advocate? What should we do?
How should we
as
advocate?
women, especially women in their 40s, perimenopausal, premenopausal, then going through menopause? How should we advocate? When we go to the doctor, of course, as health professionals, we know the terminology, but for everyday lay people, you don't know the terminology. So, you know, how should you advocate for yourself? Because of course you and I would say, well, look at your C-reactive protein, look at things like that, but they don't know that. So how are we gonna advocate? And then we're gonna go back to Ms. Stooks, because to me it's alarming that she went for bronchitis and then they don't see anything with a heart issue. And she go back 2 weeks later, she in the hospital, triple bypass.
Well, that's what we call the medical apartheid system, right? Being looked at in such a way that your symptoms are always minimized, always. So I think one of the best things that we can do, which is really tough during COVID, but now we can do phone calls or Zoom, is to have somebody with us. Because when you are in any kind of health crisis, it's very difficult. You know, you're overwhelmed with your own feelings. I mean, even if one knows these things, it's difficult to know, to remember rather. So what I tell people is to have the physician talk to the relative on the phone. So you call them up when they are in the room with you and just hand them the phone. Don't even ask for permission, because
Don't ask, wait a minute, don't ask for permission.
do not ask for permission.
Just call your family member. Just call your family member.
Call them and say, I'm here in the emergency.
Call them and say, I'm
department."
here in the emergency department.
Right. And here is
Right. And
the doctor, and I want you to explain what's going on. And then the relative will say, by the way, she's got diabetes. Did you check her heart? So of course, what does that mean? It means that the family really needs to be educated, right? Or at least you have one member. And in the church, there are people who are doctors and nurses. So it doesn't even have to be a family member, right? Just somebody that you trust with, and preferably if they've got any medical knowledge. Because I will tell you, once the team finds out that you have somebody with medical knowledge, it completely shifts.
It completely changes.
Completely.
It completely changes.
Right.
Completely.
All of
Because
a
when you go
sudden-
and you talk the terminology, and that's what I do for my family. When I go in, I don't allow anything. I tell them, put them on the phone. Let me talk to them, because I need to talk to them. Now, Mrs. Stoops, want to go back to her for a minute, because when she was in North Carolina, and I see her daughter is even here, which is great, because family dynamics of how when we suffering with these heart conditions. Now, Miss Stu got a sick daughter in North Carolina. She was there. Her daughter called me. I never did talk to the doctors, but I prayed and I asked her, what are they telling you? So I could know what they were saying. Now, Mrs. Stu, do you feel that it was doing something to your heart? Of course, we as mothers understand, but you had to go to North Carolina to see your daughter. And then here you are, because you and your daughter ended up in the hospital in North Carolina together. Is that right?
Correct. Yes.
Okay, so tell the ladies what happened after you left the hospital with the bronchitis. What took you back the next 2 weeks?
Okay. They had put me on some antibiotics, and I went in the room and told my child, it's been 3-4 days and I'm still feeling bad. But I wasn't having any chest pains, was doing a lot of sweating, night sweats, waking up soaking wet in my clothes. And so he got his friend to take me to the hospital. And when he took me over there, that's when I stayed. They kept me in the hospital. After they was treating me with antibiotics for bronchitis for maybe about a week, almost 2 weeks.
You're muted, Bishop.
I'm sorry. Then you end up going back. Now, your daughter Marnell is on here. I want her to jump in for a minute, because I'm just trying to figure out, Dr. Gigi, and I know all these sisters on here think the same thing. I'm thinking, where's the disconnect? How we go to the doctor for bronchitis and end back up 2 weeks later with triple bypass? It can get real scary. That can be real scary. So I don't want the sisters on here to think every time you get bronchitis, and the next thing you know, you're gonna end up with triple bypass. But I see you there, Marnell. Marnell, I know you definitely one who will speak up. You definitely one who will speak up. And when you
I
called
thought I
me,
was muted.
called me, okay. Well, you unmuted. We can hear you. Okay.
Am
Well,
I? Can you hear me? Can you all hear me? Oh, okay. So, how y'all doing? I am Mary's daughter. And I definitely was there from the beginning to now of the entire experience, because I do remember the call where she told me she wasn't feeling well and she was sweating and she felt like she had pneumonia. That's what, I believe that's what they were treating you for. He was like, you feel terrible. So for me to leave DC and come to North Carolina, I was just coming for the weekend thinking I'm just going to check on her. So to find out, when we talked to the doctor that she had actually had a heart attack, that was very shocking to me. And, one thing about my mom, though, because she has been there for so many of her relatives, her mom, her husband, her child, her sisters, she does do a lot of research on things. So she does speak up and she tries to understand what the doctor is saying in relation to her health. And so, we were pulled. Well, I don't know. Listen, I'm late because I'm working out. I'm trying to keep my heart together. But what I wanted to know is, I don't know how far you got in your story, Mom, so I don't want to overstep. And you're just talking about getting to the hospital and finding out that you actually had a heart attack. And then we're pulled in a room with the doctor. And I literally still have the video. And the reason why I recorded what he was saying is because now I took my camera out and I started recording, because I know that I'm not that good with medical terminology. So I wanted to remember and then go back and research what he actually said. But one thing I did understand, because we went through it with my stepdad, is that he said she had 80 or 90% blockage. And that was very shocking to me. And he said she's going to have triple bypass. I remember triple bypass because of my stepdad. So again, I was like, how did we get here? She was just, in North Carolina going to, take care of her other child. And how did she end up like this? Yeah. So for me, I guess my concern still has been, if things are hereditary, because I do know that some things can be hereditary, how do you know if you have, because I go to the doctor a lot because sometimes my legs or calves feel cold and my feet take a long time to warm up. And because I know everything that my mom has gone through, I'm like going to the doctor because I'm going to go, because I want to know, does this have to do with anything? So they do the test and they tell me I don't have any blockage, but I'm just saying that to say, always still go and check. But it was very shocking to me to find out that she actually had a heart attack. Yeah. I don't know what that's supposed to look like.
Yeah. Yeah. Well, we gonna have Dr. Gigi to speak to that, because Dr. Gigi, and what Marnell's even describing, we know sometimes with restless leg syndromes, and it can be, we're not trying to frighten anybody, we're trying to empower us as women. When we go into doctor, especially when in our 40s, the women 45, 50, Dr. Gigi, how do we know? Now, I didn't marry it. Her incident was precipitated by a heart attack. I didn't realize she had actually had a heart attack. But when we go in, Dr. Gigi, we should always have someone advocating for us who has some type of medical knowledge, or should, and also I want to address the cultural competency. Because, a lot of times we go to these positions, and as you say, they kind of dismiss us as women. They think we complaining. They think it's not real. Does cultural competency have something to do with that as well?
Of course. So actually, it's not just African Americans, but women's complaints. There have been lots of studies around heart disease also tend to be dismissed. Like I said, because the symptoms may not be the typical symptoms of chest pain, you'll get told, oh, you know, it's heartburn, or oh, bronchitis. But I think the main and cultural competency, you know, first of all, it's not just cultural competency, it's knowledge by the physician, right? So if the physician himself or herself doesn't know that diabetes puts you at a very high risk of heart disease, and that it will present differently in patients with diabetes and in women and the elderly, well, it's just plain competence of the physician.
Okay.
So studies show that, and this is why it's so important that we try to get more physicians, nurses, nurse practitioner, PAs of color, because studies show that when you're being taken care of by, let's say, an African-American physician or clinician, your outcomes are better.
The outcomes are better. Absolutely.
Yes. Oh, this is
Absolutely.
over and I mean, like significantly better, sometimes as much as 70% better.
Did you say 70% better?
Yes, ma'am. Yes, ma'am.
So
And-
if we get a physician, a PA, a nurse practitioner who looks like us, we have a 70% chance of being treated better.
Yes, ma'am.
Oh,
Yes,
I'm
ma'am.
thankful. All mine look like me. Most of them.
Right. So, and by the way, just because they look like us doesn't mean that they're going to be good. So there's
This is
that,
true.
right? Because
That's
some
distinct.
people, right, some people don't identify.
Because
from
you
a-
don't particularly look like me, but you're me. See, because
Right.
you're Egyptian. You don't particularly look like me.
right,
So
right,
I
right.
got one of the best in my corner, and that's you.
Yeah.
So when I say
So-
look like me, I'm saying people understand culturally
Yes.
where I'm coming from and don't dismiss me.
Yes, yes. So remember that for cardiologists, there's the American Black cardiologists, and we've got some wonderful cardiologists in DC, and that's a place where you can research them. One of my dear friends, Dr. Reginald Robinson.
Robinson, that we had on the panel.
Yes, ma'am. So he is somebody that's just terrific.
Yeah.
Do you know him, Ms. Dukes?
Wait a minute, she need to unmute herself. Miss Dukes?
Yes, that's my cardiologist. The
Yeah.
best.
He is the best. He is the best. So
Yes.
I just want to come back to something that you asked about prior, Bishop Webb. And that is, first of all, let me tell you, your symptoms of the sweating, and that's actually when you were having your heart attack. That was your heart attack.
Oh, okay.
Wow. So how can,
Yes.
wait a minute, Dr. Gigi. So tell these menopausal women on here. How, because menopause, you know, you say you be having, I'm having a moment. I'm having a moment.
Yes. Well, I think it's a very good question. Usually with menopausal sweats, they come and then they will go, right? This is prolonged sweats. She was having them as night sweats. That was the whole night. Whereas, but you know, I mean, I'm giving you some overall guidelines, but everybody is different. If you feel that you are there's a change, that this is not right for me, that's when you should have it checked. And I will say for you, Ms. Stooks, or your daughter, actually, you might want to see Dr. Robinson to have him check your heart and make
Give his first name,
recommendations.
Dr. Gigi.
What's that?
Merchant.
Give Dr. Robinson's first name because we have questions about saying his
Okay, I had
name.
to step away.
Yes, Dr. Reginald Robinson, and he is in private practice and he admits to the Washington Hospital Center. So for Ms. Small, I would suggest that you make an appointment with him so that he can do preventive cardiology, right? So he's going to check your blood pressure. He's going to check your glucose, something called an A1C, to see if your glucose has been elevated for the last 3 months. He's going to check your cholesterol. And I didn't mention that family history is a risk factor. So there are also other ways to look and see if you're, how old are you, Ms. Bernal? How old? Can't hear you. Can't hear you.
Wait a minute, Dr. Gigi. Let me see. Wait a minute. She can't hear you. She can't hear you. She need to unmute herself.
Okay, can you hear me
Okay,
now?
yeah.
Okay, I'm sorry. I'm driving. I'm sorry, but I'm 46. I know I don't look like it, but I'm 46.
You do look very, very,
You do look
touch wood, very good.
You look like
very
26.
good.
You look like 26.
So you definitely should be seeing Dr. Robinson
Seeing Dr. Robinson.
so that he can do an
So that,
assessment.
he
I'm going
can
to have you mute because we're getting some feedback.
because we're getting.
The other tests that can be done. So let's say that Ms. Stooks came to me and there wasn't any evidence of any active heart issue at that time. That doesn't mean that she was not at risk. So what can we do? We can do a stress test. And let's say that she has arthritis and it's difficult for her to do a stress test. There are chemical stress tests. And then there's something called a heart scan. A heart scan can tell you how much calcium. I'm sorry, I can't hear you, Pastor.
Dr. Gigi, did you say a chemical stress test?
So let's say that you just, you can't exercise on the treadmill because you've got bad arthritis. The chemical stress test kind of mimics the exercise to see if there's any blockages. The next step, if let's say you're not symptomatic, but we're still worried that you're at high risk for heart disease, such as Ms. Stooks, she's not having any symptoms. She does the stress test. It's normal. She can still be at risk. So we would go then to a heart scan, because a heart scan shows how much calcium there is in those 3 arteries. And then the ultimate way to know if there is any blockages is to do a cardiac cath, where they actually physically look in there. They put a catheter in your wrist and they actually physically look at the blood vessels. The advantage of a catheterization is that they can actually put stents in there to open things up. You were not a candidate, Ms. Stooks, because of the diabetes. There was sort of what we call diffuse disease. But I will tell you, Bishop Webb, if there is somebody that's coming to me and they have a lot of risk factors, and let's not forget the younger women, they don't have to be menopausal, with lupus or rheumatoid arthritis, they are at higher risk. And she's having, symptoms that are concerning for heart disease. I might not even fool around with all those other tests. I might just go straight to cath, because you're just kind of delaying things. And if your suspicion is very high, why fool around? You can just go straight to cath. But those are the kinds of things that, I can't speak to individuals. This is when you need a good cardiologist. And another thing that I just want to add, I'm a general internist, right? But sometimes people don't know what they don't know, so they can be very dismissive. So ask to see a specialist. So for Ms. Stooks, if you're in the outpatient setting and they're saying, "Oh no, don't worry," or even in the emergency room, bronchitis, and you say, "No, I feel that there's something else. I'm worried about my heart. I want to see a cardiologist." And if they tell you no, say, "I want to speak to the patient advocate." I guarantee you that things will change.
Good. That's good, Dr. Gigi. I'm glad you said that, because a lot of people don't know you have patient advocates in hospitals. Ask to speak to the patient advocate, that you don't be dismissed, because that's a huge issue. It's a huge issue. And especially a lot of times when we women, they say that we're just complaining and, it's not real. I had that experience even with severe COVID, and thank God you. I always say you're the angel that God used to save my life, because they dismissed me. And I had severe COVID and almost died. And if it wasn't for you, I wouldn't have done that. So I wouldn't have been here. I know I wouldn't have, because of course we know my story and how low my oxygen level went. But if it hadn't been for you calling the hospital and saying, "Let me speak to the physician," and I'm transferring her. I want her out of there. But everybody don't have that privilege, and we're trying to educate the women all around the world, because we see Lisa Marie Presley dead, 48, from a heart attack. We see the incident with the young man, Damar Hamlin, last month, 20-something years old, dropped dead right there on the football field. So we're going to talk to you about that because, you know, you and I, we tried to do the CPR only, where we could teach you how to do CPR compressions only. Because if something happens to someone in our midst, at least if you know how to do compression only CPR, it could potentially save your life. Now, Ms. Stoops, I want to hear from her the escalation, Dr. Gigi, because if we don't get something taken care of, it can escalate. Now, Ms. Stoops, now I want you to go to share with us. Now you had this open heart surgery. You had
Yes.
triple bypass.
Yes.
Then what happens? You have diabetes. You have triple bypass. Then what happens?
Well, I was having complications with the diabetes. I had a toe that was partially amputated before I even had the heart attack. And so, like I say, after that, that was June 29th, 2017, when I had the bypass. 2018, that's when I went and got my right foot amputated. Poor circulation, wasn't no blood flow. The toes was just drying up or whatever. So they tried to put a artificial stent. I don't know if I'm saying the word right.
Someone,
They didn't use my back.
can I say something? Remember, the cause was, they took the biggest vein they took the largest vein out of your leg to fix your heart. So it messed with the blood flow to heal the foot. Remember that? That was the important part.
Yes.
Okay, I'm going to go back to mute.
Yeah, so then, like I said, I didn't have my own veins. They used the artificial veins to do the bypass to try to save the foot, which that ended up getting infected. And so they had to remove that prosthetic vein out, and I ended up getting my foot amputated. And so I want to say 3-4 months later, the left foot wasn't getting no circulation. By then, there's no other veins to use for anything else. She wanted to cut another toe off, telling me that she wasn't sure that I would still get circulation. They had already, my big toe on that left foot was already amputated. So she wanted to do another toe that was partially hanging on, wasn't healing or whatever. So eventually I told her to just go ahead and amputate the foot, because I'm not going to keep going back and forth with them amputating toes and this one. And you're not guaranteed that it's going to work. So just take the foot and leave me. And that's what I told her. So so I ended up being a double amputee within 3-4 months apart.
I'm so sorry, Ms. Stoops. That's a lot to go through. I mean, you've had thing after thing after thing, and on top of that, your daughter. I can't imagine what that was like. I mean, you know, that's awful. And I think it underscores the importance of not just looking at the heart. When there's something going on with the heart, it's really all the blood vessels that need to be looked at, including the blood vessels that are in your neck, the carotid arteries that feed your brain. Because if there's heart disease and issues here, there can be issues here and issues in your the circulation to your limbs. And one of the things that with these highly specialized people is that they don't tend to look at the whole system. And I would say that especially in peripheral vascular disease, meaning the disease that affects the limbs, the blood vessels in the limbs, is often overlooked. I think also that when you have diabetes, you really need to have a team of doctors. First of all, the control of diabetes has become much, much more complicated. There are many, many medications there are out there. And I, as a general internist, I used to manage people with diabetes, and I still do. But if I can't do that, I send them to an endocrinologist. You should have a cardiologist and an endocrinologist. You should be going to the eye doctor on a regular basis because there are eye complications. And if there's anything going on with your kidneys, even if they tell you, oh, your kidney function is a little bit off, you go and see a kidney specialist. Because some of the things that you talked about, probably all of the things that you talked about, could have been prevented. Because once these things, it's like it starts to roll and then the complications happen.
Yeah,
And
yeah.
I will
Because
just add
Dr.
this one.
Gigi,
Yes, ma'am.
a couple questions, and for typing questions in the chat box. Thank y'all. We gonna get to your questions. But did you say it again? You told them to see an endocrinologist. Ask to see the endocrinologist, the one who checks your endocrine glands, those glands that controlling our hormones and all of that. And also, Dr. Gigi, something I've always done, especially after I turned 50, but of course, because I'm a health professional, so I knew. But I would always keep up with my A1C. I want to know what my A1C is. So ladies, write this down. If you don't know, you go get your physical, ask to get your A1C checked so you can start keeping a timeline of your A1C. Also, Dr. Gigi, I would ask, I want to know, every once in a while, I wanted a profile. I wanted a profile, I wanted a hormone endocrinologist I had to go see, because of course I had thyroid issues. So I want to see, I want you to get a profile so I can see what my estrogen, what everything is going on in my body. And that way we have a timeline. Now we have two questions for you, Dr. Gigi. One is, does cardiac catheterization require anesthesia?
No, it doesn't. What they do is they give you numbing medicine at the site where the catheter goes in, and now it can be done in the wrist. We used to do it in the in the groin, but now it's turned out that it's actually safer with less complications than the wrist.
Oh,
Yeah, it's much easier in
we're going in the wrist instead of the groin.
Yeah, the recovery is much faster too. And then they just give you something to relax. It's kind of the same as when you get a colonoscopy. So no, you're not put under anesthesia.
Okay. Then the other question is, somebody want to know where you practice. I say all over the world.
I just left GW, and I'm going to be starting at the MedStar on Lafayette sometime in early March. So yes.
Yay!
Thank you.
So she's going to be at Georgetown. She's going to be there at Georgetown Hospital, and I tell you, you won't regret. Now, my bishop, you know, I was telling him that she's his doctor, and as he said, you know, they had given him no time to live. He came to see you finally, and you told him he's gonna live, and he's still living. She's an absolutely phenomenal physician.
Oh.
And no joke. This is the truth. Now she's a doctor, and that's why we're so honored today to have you. I mean, you take care of presidents and presidents' children, and you come see about little old us. I just want you to.
You're not. First of all, let me stop you right there.
No. Can y'all just help me give God a praise that He sent us Dr. Gigi? Can y'all just help me give God a praise for that? Because any physician that's taking care of presidents and presidents' children, and we wouldn't even be on that scale. We wouldn't even be on that level.
Yes, you are.
Us, I know how you feel, and you're right, Pastor Hill. Humility personified. That you coming on today and sharing with us so freely, we so appreciate it. But she's going to Georgetown, and so you can look her up. And we'll put her name up here with some other stuff we're going to do in our second half of the segment. But I promise you, she's going to take care of you. She's going to look out for you. My son, he got jealous. Now she's his doctor. But, well, you know, the thing that I know about you, Dr. Gigi, and unfortunately for a lot of us women that we don't have, is doctors who, first of all, know their limitations. Secondly, for those that will then recommend other physicians to us as specialists to make sure we get the whole picture.
Yes, yes.
Because now, Ms. Stoops, how did you feel? Feel like somebody had dropped the ball? Because just to summarize your story, we've gone from having bronchitis to having a heart attack unknowingly, to having triple bypass, to becoming a double amputee, all in a year and a half, 2 years. Did you feel like somebody dropped the ball? Did you feel like, we need to go sue somebody? How did all this happen?
Yeah, I mean,
Something
obviously,
happened in yeah.
I did feel that way, but I felt like I needed to take that time and get to living. I did. That thought came in and went out far as trying to sue somebody. So I was just trying to get myself back to where I was at. I didn't want to deal with no lawyers, no this, running back and forth to the doctors, whatever. So no, I did think about it, and then it just briefly and thought went away.
I will tell you this. I think a lot of people feel like you, Ms. Stoops, and of course, your circumstances are above and beyond what most people have to deal with all, not just the complications, but the loss of a child, which to me is the worst thing that any human being can go through. So again, I'm sorry for that. But I think that if I were in your situation, I don't know about a lawsuit. That's an individual decision. But what I would want to know is that this doesn't happen to somebody else. And so really then what you can do is you can make a complaint with the hospital and you can say, look, this could be a lawsuit and it could be your daughter that comes, and it's not too late, by the way. We could be suing.
Say that again.
Your daughter can do this on your behalf, even now.
It's not too late, even now.
It's never too late, never too late. And you can say, look, we have a potential lawsuit, but we don't want to go this way. We want you to investigate all the cases of people like me in my demographic, being African-American, being a woman, to see what the outcomes have been. Because this is publicly available, information. And if there's a problem, we want you to institute some kind of educational intervention. And guess what? I'd be happy to talk with, the students and the residents, whomever, the faculty. I think that's where we can really make a difference. I mean, we tend to think about lawsuits as teaching people lessons. It really doesn't. I mean, a little bit it does, because it, gets them, where it hurts, but it doesn't kind of do anything to prevent somebody else from having the same experience.
Because that's the thing. We want people to get educated that this doesn't happen to someone else.
Yeah. Now, mind you, I'm not saying that you shouldn't sue. I'm just sort of saying the options, and given what you feel, of not sort of wanting to deal with that headache, because it is, it is a headache.
Well, I mean, her daughter's on here, and I said
Yes.
something to her before as well.
Yes.
Because how you go through, I mean, Dr. Weighty, is so disheartening. Even though you have diabetes, there are people who have diabetes and manage where they don't become a double amputee within years. What is going on there? So we need to really pay attention to that. And diabetes and the devastating effect that even diabetes has on individuals. We need to become more educated. We're so grateful again today for you.
Yeah.
Because
I want to just add one.
I just wanted to say, because I'm driving, so I have to scroll back, but
go ahead.
The thought did come to Sue, and I, did everything I could to gather all the information and everything. But one key thing that my mom said is that going through something like that already without a lawsuit even involved, it takes a lot of mental brain space to even get adapted to your new normal. So the both of us table that. We tabled that so that we can focus on her living. so we can focus on her being the best her as is right now. And so I have been talking to people, and I know that you know, you have there's a statute of limitation where you could do this. And you know, I am, you know, do want to revisit, like, how does something get infected? You know, something you put in her get infected. They cut my mom several times. It was almost like they treated her like a voodoo doll. They
Like
cut her so
anything.
much trying to find veins.
Like
As, you know, instead of, you know, knowing, you know, I mean, you got machines, you should know which vein to get. But they cut on her so much, like, oh, we can't use this one, we're gonna go here. She has cuts under her arm for no reason. So, Dr. Gigi, I would love to reach out to you later. You know, one thing that also was a little discouraging is, you know, they say that malpractice, when you sue doctors, it's really hard because doctors stand up for each other. And you would have to get another doctor to say that a doctor did something wrong. And I could be wrong, you know, but again, definitely want to revisit it. But I also know that had I tried to do that and help my mom get to a mental place where she's able to adapt to her new normal, which wasn't hard because she's amazing and she's strong,
yes,
and we
she
come
is.
from good
Yes,
stock.
she is. Yes, she is.
And
Yes, she is.
you know, is this the strongest woman I know, but she does deserve to know where someone went wrong. She's not crazy. She knows that something went wrong somewhere, and it's worth the investigation, and we will.
And
So
that's what,
when I stop
and-
talking,
and
you can
that's
mute
what-
me. You can mute me because I can't mute myself.
Okay, dear. Okay.
So what I would say is that that's why I said it's an individual decision, because it does take a lot. But there are other things other than lawsuits that you can do, and I will make sure that I get your information, Ms. Dukes, because I would love it. And if you would like, at some future point, to come and speak to people that work in the emergency department, that are cardiologists, that all, you know, these things, because this is a very powerful story. And I've learned that when people hear directly from patients about these experiences, that will stay with them much, much more than a lecture.
Yes. Now,
just-
she was a patient in GW, Dr. Gigi. She was
Yeah.
there in GW.
Yes, yeah, well, we need
In
to,
GW.
I mean, we'll
Yeah.
talk about that
Yeah,
offline.
we'll talk about that offline.
And ironically, the doctor who
I'm getting so much
performed all of her
feedback. I'm
surgery,
getting so much feedback.
ironically, the doctor who
Okay. Okay.
I was saying, ironically, the doctor who did all of her surgeries passed away like 2 years ago. She was young and she passed away from a heart attack.
Oh, I know who you're talking
Mm.
about.
I know who you're talking about.
Yes.
Yeah.
Yes.
So can
So
I just say
you can
one
mute
more
me, I'm
thing?
sorry.
It's okay. Can I just say a couple of things? Why are we spending so much time talking about diabetes? Because it is that common among African Americans in general, but specifically in African American women. And there is not that understanding about the link between diabetes and heart disease. One more thing that you should check is your urine to see if there's any what we call microalbumin. Because if there is, that is another risk factor for heart disease. You know, it's one system, right? So problems with the kidneys affect the heart. Diabetes affects the liver. That can actually be a cause of cirrhosis, believe it or not. So you need to, and if I could just finally say this, if you're not happy with the care that you're getting, switch doctors. If you're not, I mean, emergency department is different, but if the person that is taking care of you is not listening to you, is not taking your complaint seriously, or is not up to date on the information, and you ask them about the microalbumin and they'll say, oh, I don't think that's necessary. That's somebody that doesn't know what they're doing.
Yeah. Okay, Dr. Gigi. So now we have another question from our Facebook from a man saying they were recently diagnosed with irregular patterns on their EKG, what kind of diet or supplement should they take to get back to normal?
Okay, so remember we talked about the other system, the 4 systems, that's the electrical system. So let's talk about, let's say that the wiring is because it's aging is becoming a problem. Really what you need to do is to find out what is causing that in terms of the heart, because it could be a little bit of scar tissue and then actually you can zap it. It's called an electrophysiologic cardiologist, or EP for short, is the person that you need to see. I'm not sure that there's anything one can do for diet or exercise for that kind of problem. However, having said that, there may be other parts of the heart that may be affected. So in general, it's good to follow a diet that's got lots of great color as your guide, fruits and vegetables, minimizing, eating out, saturated fats, increasing, having red meat on occasion. You can actually find all of this information. Again, the American Black Cardiologists, blackdoctor.org. There are many organizations where you can find good information, but that particular problem needs to be followed up, because usually it's not something that can go back to normal. And that kind of problem is very, very serious and actually can lead to death if it's not taken care of. Can't hear you, muted.
It can lead to death if it's not taken care of. And so we need you to go see a cardiologist. And we've given you one name, Dr. Reginald Robinson, an African-American cardiologist who is a great physician. So we've given you that name. I think we've been so inspired, and ladies that's watching, make sure you type in the chat box if you have any questions. In a minute, we get ready to do our first round of prizes. So I'm getting ready to give out a prize, but I want to welcome down our second survivor. She's all the way from Hawaii, Mrs. Waukesha Nicholas Stewart. Hello, dear.
Hi, I hope you can hear me okay.
Yes, we can hear you. Thank you so much for joining us. I know it's earlier over there in Hawaii, so thank you for getting up and looking so pretty in your red to share with us your survival story. We can't wait to hear it. We can't wait to hear it. Miss Waukesha has even been Dr. Gigi, one of the spokespersons for American Heart Association, and we're going to give you all those resources. You have all those resources, but she's been a spokesperson for the American Heart Association. And so we thank God for her. And she's going to share with us today her story of survival. And so,
Yes.
we want all the women to know, and God put this on my heart because we want to become better educated. Because to me, Dr. Gigi, we're more powerful when we're more educated. And what better to hear from individuals who have survived, who've been through it, and can tell us something, because I think we've all learned something from Mrs. Stoops, that I got bronchitis, and then I go back 2 weeks later and I'm having a triple bypass. So if anything going on up here in my upper area, I need them to be thorough about my treatment, not just to dismiss me and send me home with antibiotics. I need them to be more thorough, and especially if I have a predisposed condition like diabetes, which a lot of African Americans, if you don't have it, you're pre-diabetic. That's why we need to know what our A1C is. We need to know the cumulative effect of our blood sugar over a 3-month period. We need to know. And we also got to, before we close today, we're going to also share, we got to eat healthier. We got to eat healthy, and especially when we know we got family, history, as Dr. Gigi has told us, family history of diabetes, of heart disease, and so many women are dying from heart attacks and strokes, Dr. Gigi, and young. I just saw yesterday the actress Irene Cara. I didn't know she was dead. She died from heart trouble months back. I didn't know she was dead. So this information today that we're receiving, especially from survivors, because everybody don't survive. So Waukesha, welcome to Weighty Heart Matters. can you begin to share with us? Just tell us a little bit about yourself, Waukesha.
Sure. I am 42 years old. I am a nurse. I am a mother, a wife, mother of 3. I am a mental health advocate and a women's health advocate. I'm very passionate about making sure that all women, especially our community, that they know and understand how important it is to be an advocate for your health and to be heard. We have to take control of our health because we're the only ones who are really going to be passionate enough to save our own lives. Oh, you're muted.
I'm sorry, I forgot to unmute myself. Let me recap. You are a nurse, which is great because you can advocate for yourself. You're 42 years old, and you are a survivor.
Correct.
Okay, tell us about your story.
So back in 2011, when I was 31, I gave birth to my second child.
You were 31.
I was 31. 2 weeks after delivering my second child, I had what they call a spontaneous coronary artery dissection. So in simple terms, a major artery in my heart tore. It created a 100% blockage, and that caused me to have a widowmaker heart attack. Now, when it happened, I was at a dinner party at a friend's house. You know, we were celebrating the fact that I had just had this baby, and I was out for the very first time since having my second son. When it happened, see, women experience different signs and symptoms when it comes to heart attacks. It's not always the same as men. So when mine happened, at first, I did feel a sharp pain in my chest, and I suddenly became dizzy, kind of foggy brained is how I like to describe it. The person that I was speaking to, I couldn't really focus on what she was saying to me. And I had to excuse myself. I got up, I went to the bathroom, I splashed water on my face. And that's when I started to feel this heaviness in my chest. And I couldn't breathe. And I felt my heart rate become erratic. I went back out of the bathroom, I sat down, I became more dizzy, and then I started to have that radiating pain throughout my neck, into my jaw. I had the numbness and the tingling down my left arm, and my chest, I felt like it was in a vice. I felt like I was literally being crushed. Now I was, you're muted.
All of this happened, Waukesha, in a period of how long? Minutes?
Within a few minutes of me initially having that first bit of pain in my chest, it was within 5 minutes I started having these large onset of other symptoms. Now, like I said, I was 31, I just had a baby. I was an athlete my whole life. My family does not have any sort of cardiovascular disease, you know, in my family history. So at the time, even though I was a nursing assistant at the time and I knew the signs and symptoms, I didn't put all of that together because you don't realize that 31-year-old healthy women can have heart attacks. But when I went back to sit down and all of my symptoms became worse, I looked to my husband and I said, something's wrong, something's not right. And, you know, of course, I had had a glass of wine, maybe a half a glass of wine. And he said, are you sure you just didn't drink too much? It's your first time, you know, since having the baby. And I said, no, something is not right. And then he took me to the hospital. We rushed to the hospital. As we were in the car, I began to vomit. You know, a lot of women who have heart attacks, you know, you have that sensation of, let me just take my bra off. That will, you know, help everything because you have that crushing sensation. You just want all of that pain, that pressure, you want to be able to breathe and you think that's going to help. By the time we got to the hospital, my husband, he parked in the emergency spot, rushed me in. I told the registration all my signs and symptoms, and she looked at me. And mind you, I'm still having all the breathlessness, the pain, the chest pain, the tingling, the radiating pain. I'm still vomiting. And she said that I was having an anxiety attack. If I did not,
she told you were having an anxiety attack?
yes.
Wow.
At registration. Now, if I weren't the person that I was, if I didn't know myself, know my body, and know that that's not what it was, I could have been sent home and I could have died, essentially. But I insisted that I wasn't going to leave. I didn't allow her to just dismiss me. And she kind of rolled her eyes and said, okay, well, if you want to be seen, you can wait in the ER waiting room and we'll have someone attend to you. You'll be called momentarily. Minutes go by, I'm still experiencing, I shouldn't be here. I should not be here, because the amount of time that it took for me to be seen in triage.
Wow.
By the time I was seen, let's say about an hour or so had gone by from the onset of my first set of symptoms, signs and symptoms. They finally bring me back. They run an EKG. I'm still vomiting. The nurse and the tech that was in the room with me in triage, they didn't know what to make of, my EKG and all of the signs that I was showing and all my symptoms. My guardian angel walking on earth, a more senior nurse, was working that night in the ER. She walked by my bay. She took one look at me and said, she's having a heart attack. And then once she said that, it clicked. It clicked. And I realized, wow, I'm 31 years old and I'm having a heart attack. And in that moment, I thought I was done, because so much time had passed. They rushed me into the back. They started working on me. Nothing that they did helped. They gave me more oxygen. They gave me morphine. They gave me nitro. Nothing seemed to alleviate the pressure, the pain that I was experiencing. So the hospital that I was at, they did not have a cardiac intervention unit. So I had to be rushed to another hospital, where they went in and they told me that I was in fact having a heart attack. I had, the quote unquote widowmaker type heart attack. My artery was 100% blocked. It needed a stent in order to save my life. And I am thankful for the fact that the doctor that was working in the ER that night, the cardiologist that was there that night, had seen one other case like mine in his 30-year career the year prior. See, SCADs, they say that SCADs, they are common, but meeting a survivor isn't.
Yeah.
Because it's very underdiagnosed. It affects women greatly. It affects especially, menopausal women, pregnant women, and it affects women disproportionately more than it does men.
Wow.
By the time a woman gets herself to the hospital, sometimes it's already too late. Sometimes we're dismissed. We're not believed. We're told that we're having an anxiety attack. We're told that we're being dramatic. Unfortunately, there have been many women, including professional women, who have passed away because they weren't diagnosed properly.
Wow.
I am extremely fortunate. And they say now, I know with the American Heart Association, their statistics show that more commonly, women who have heart attacks between the ages of, I believe it's 20 to 50, it's more attributed to SCADs. It's more attributed to the spontaneous tears. And now I believe that my survival was based upon my parents instilling in me from an early age healthy habits. We have diabetes in our family on both sides. And from the time that I was younger, my parents, taught me how to eat well. They insisted that, myself and my brother, that we remain active our whole entire life. And I think
So-
if not for that, I wouldn't have had a strong enough will to have had survived. My body was already in, this form to try to heal itself and to survive.
Okay, Waukesha, let's pause for a minute and recap. We want to recap here what you said to make sure we understand. Now, Dr. Gigi has put it in the chat box, so you know what SCAD is. Spontaneous coronary artery dissection, most common in pregnant or postpartum after you have the baby, women. Now, Waukesha, you're sitting, this goes back to what Dr. Gigi was telling us earlier, that you need to have an advocate, you need to have someone there. You're sitting in a waiting room in triage, actively having a heart attack, and they keep you sitting out there for an hour. Then when they bring you back, you're still vomiting, which they're supposed to know all the signs of a heart attack, the tightness in your jaw and everything. They're supposed to know all of that.
Yeah.
But they still didn't bring you in the back and tell you having anxiety. Did we hear that correct? Then they have to transfer you to a hospital that's better equipped to handle your situation, because God sends you an angel in there, because that's the way I feel, Waukesha. I call Dr. Gigi my angel, because I know if she hadn't gotten me transferred out of the hospital where I had an oxygen level of 70 and it was steady dropping, she called and said, no, we're getting her transferred now, I would have been gone. I just know that. So God sends us angels. And so your angel walks in the ER, the physician says she's having a heart attack. And so then we start escalating, taking care of you and treating you as if you're a heart attack victim. Is that right?
Correct. Correct.
So when they take you to the next hospital, then now they're intervening with you having a heart attack. And this is postpartum. The baby's now how old? 2 weeks?
2 weeks.
2 weeks old. Now, Dr. Gigi, can you help us with that, even for those of us who have children, who may have babies? I mean, we're listening to Waukesha, but to me, Mary and Waukesha's story is just so alarming. I mean, how can we even try to protect ourselves from that? Because Mary goes in, you think you got bronchitis. 2 weeks later, you're back, you got triple bypass. Waukesha have a baby, 2 weeks old, go in, she's having these pains and all of that. Dr. Gigi, help us. What, let me put it like this. What are some of the things postpartum? Because Waukesha was so alarming, Waukesha was 31 years old. And a lot of people fail to realize you can die from childbirth, during childbirth, after childbirth. What is it that we need to advocate for when we have family members who have a baby, and hopefully, prayerfully, they will never have a widowmaker heart attack? But how can we advocate, Dr. Gigi? Or was it anything that could have prevented Waukesha from having this scare?
Okay. Great questions. And thank you, Ms. Waukesha, for sharing everything. I'm so glad that you're well. But what your story illustrates are a couple of things. One that we had spoken about earlier, and that is when one is in, acutely ill, you don't have, it's not the presence of mind. You just are distracted by what you're feeling. So even though you're a professional, you're a nurse, you know what the signs and symptoms are, because of what, your postpartum, all of these things, it's like, it was only when somebody else said it that you're like, oh, it clicked. The second thing that your story illustrates, and there's been a lot of studies on this in pregnant African-American women. Pregnant African-American women, and I'll include the postpartum, have worst, a professional African-American woman with a degree has worse outcomes than a white high school dropout. So that speaks again to the whole medical apartheid system.
Wow.
So I mean, it's shocking. I mean, that's why I decided to create the Rodham Institute to work towards improving health equity. I mean, it is shocking. And there are lots of horror stories. There's actually the New York Times, maybe about 8 years ago, had a story about a pregnant woman. It was like in their magazine. And it was just heartbreaking how she kept getting sent back home. The baby ended up dying, unfortunately. She had had preeclampsia, which is when your blood pressure goes up significantly. You're having urine and protein in the urine, you get swollen. So that's one of the things that can happen during pregnancy, preeclampsia and eclampsia. So very important that you have an OBGYN that should be standard that will check the protein, the urine for protein, and check your blood pressure. And this is really one time that having somebody go with you for your visits is important, whether it's the baby's father or mother, I guess, and, you know, family member. That's very, very important. The other complication that is more common than SCADs is actually blood clots. And blood clots can happen as much as 6 weeks, 6 to 8 weeks after you have the baby. Think about it. When you've had a baby and, you know, bleeding, the body has to have a mechanism to stop the bleeding. And so your clotting is actually more. And so sitting in the bed, some cultures, you're staying in the bed for 40 days after you've had a baby. That increases clot risk. And in some women who are really at high clot risk because they have, let's say, lupus or rheumatoid arthritis, the doctor should give you, what do you call it, Lovenox or heparin that you can administer at home. There are just different conditions. SCAD, I've only taken care of one patient, and that was post the SCAD. That's, again, it is not uncommon, not just because you're African American, just because it is rare that people, you know, don't recognize it. SCAD is more common in women. It has a completely different mechanism than the heart disease and heart attack that you had, Ms. Stooks. In your particular case, there was plaque and cholesterol. In Ms. Waukesha's situation, her blood vessels were probably completely clear. And it's because they're more what we call pliable, they're healthy, that it's actually easier to have a dissection of the coronary arteries. That's different, the dissection that happens in the aorta, which we can talk about separately. But it's because she's actually young and healthy that she was more prone to this particular type of problem. So as I'm speaking, I think you can see that there are many different conditions that can lead to a heart attack, but actually it's not surprising that the usual treatments of morphine, of nitroglycerin, of oxygen didn't do anything for you, because the thing wasn't that you had, you know, blockage because of plaque or cholesterol. It's that, no, your artery ripped, and those treatments are not going to do anything. You really need to go for a catheterization and physically open it up with a stent. Does that make sense? This is a lot of information. So I hope that made sense, and I'll stop and see if people have questions.
Okay. Well, we want you to put your questions, you all, in the chat box. But to me, Dr. Gigi, what you're saying in layman's terms, what Waukesha had is acute, is sudden, and a dissection to paint a picture is like a part of your blood vessel separates from the rest. That's what she's saying.
It's like a
So
zipper.
there's
It's
no
like
way
a,
we could have known.
Yeah, no, it's like a zipper, it rips. And there are people that have had this in the big
And
aorta.
what is that attributed to? Her childbirth?
Yes, because she's pushing, right? She's the delivery process. So probably there was a small rip and then it just like a zipper, and then it just unzipped. It
Oh,
ripped. Mhm.
okay, okay. So, yeah, so Waukesha, so did you feel that was your second child? Did you feel any different with having the second child from the first one? Did you have a normal spontaneous? Did you have a C-section?
I had a C-section because I had gestational diabetes with both my first and my second. My first child, he was a little too big for me. And I had to have a C-section. So, commonly when you have a C-section with your first, you end up having a C-section with your second to be a little safer because of scar tissue. That was really the only thing, was the gestational diabetes. Like Dr. G said, I was healthy, I was an athlete. There was nothing for me to suspect as to why I would have this tear happen to me. Unfortunately, it is rare. Not a lot of physicians see it. And on top of that, not a lot of women know themselves enough to be able to be an advocate for themselves in order for them to, stand up for themselves when they do present at the hospital to get help. Across the board, I'm an RN now. At the time, I was a nursing assistant, but across the board, when you enter a hospital and you have complaints of chest pain, there's a protocol that's supposed to be followed. And unfortunately, women have a tendency to experience 20% longer wait times in an ER to be treated.
Wow.
And on top of that, we already wait 30% longer than men to even go to the hospital. So we're already at a disadvantage for ourselves because we try to say, no, I'm okay. I have to do this first. Women, we wear many hats. We don't want to recognize what is happening. And then by the time we do want to reach out for help, we're dismissed. And that's hard. That's a hard pill to swallow, especially for the medical community. Cardiovascular disease is the #1 killer of new moms.
Yes.
So it's very important, even if you don't have a history. And like I said, SCADs are rare. You can be healthy, not have had any issues your whole entire life and be affected. So that's why it's important to know your body. That's why it's important to have a certain type of foundation in, a healthy diet and exercise. So that way, if something were to happen, you have more of a fighting chance.
Yeah. Yeah. Well, Waukesha, and I think what I'm hearing you saying to cap what you were saying is that you're saying to all of us women, we got to be more of an advocate. And I kept hearing you say, know your body, know your body, know your body. And I so agree with that because I know that's another reason I'm still alive after having severe COVID, because I kept telling them, I can't breathe, something is wrong, my body not right. And even when, they said, okay, because I was hospitalized twice. And the second time, thank God again for Dr. Gigi. So we got to know our bodies. You have to know our bodies. And so I see that Pastor Hillary even put there that she experienced the same thing. She went to the ER with chest pain and the triage nurse dismissed it. And it's so overwhelming when you're in an acute situation to have people to dismiss what you know is real when you know your body. And so to all our women, we're getting ready to, we're gonna give out a prize. We'll give out a first round of prizes. But when we hear Waukesha and Murray's story, Murray older than Waukesha, Murray has plaques, she has buildup on her heart. But Murray goes into the emergency room, diagnosed with bronchitis, and 2 weeks later, she's in having a triple bypass. Somebody missed something somewhere. Somebody could have been a little more attentive somewhere. So you gotta know your body. Mary, because she's dealing with the emotionalism of a sick daughter. She's in another town, it's not where she lives, because that's another whole thing. She's in another town to visit her child, to see about her child. And here now, she gets sick while she's there and end up with a triple bypass. Waukesha, who would ever think? Because people, Dr. Gigi, think if you're healthy, you're young, she's 31, she's athletic, she eats properly, all of that. And here she ends up having scabs, being dismissed in the emergency room. So I think the biggest thing that we can take from them to not only their conditions and for us to be more knowledgeable, but Dr. Gigi, for us to self-advocate. You have to self-advocate and don't go to the doctor by yourself. Don't let your parents go by you. My mother died from heart disease. She died from coronary artery disease. She had congestive heart failure. Don't let your parents even go by themselves, like Marnell, making certain she's with her mother. Don't let your parents go by themselves, because we need somebody there that can ask them relevant questions. And if you don't know the question to ask, drop me a line. I'll send it to Dr. Gigi. We'll get the questions answered for you. Don't go in there alone. Don't do that. Because we're seeing, Dr. Gigi, we're being dismissed.
Let me tell you something, Bishop Webb. I mean, I've been a doctor for 37 years. And this last little bit since COVID, these last few years, for all the stuff that they talk about, implicit bias and DEI, diversity, equity, and inclusion, it feels like things have gotten worse. And I think it's because of the previous administration. And I'm sure, you know, the women on the Zoom can speak to me, the racism has increased significantly. And believe it or not, I have been doing so much of sort of trying to navigate people through the system. You know, I had a patient, she was in North Carolina. I don't know her, but she got through to me and she had had a heart attack. She also they found out that she had cancer. They were going to just write her off. It's like, no, she needs to be taken care of. I kind of was coaching the daughter, and I did speak to the physicians, ended up, you know, saying, look, you got to get her to Duke Medical Center. She got her chemotherapy. Most of the cancer is gone, but she needs surgery. So her doctor, her internist, primary care doctor says, no, you can't have surgery. You need to keep going with the chemo. I'm like, that doesn't make any sense. So she spoke to her cardiologist, and the cardiologist said, you can have the surgery. So I said to the daughter, please get her to somebody else. They do not know what they're doing. You know, Bishop, you are one of many Black women that I got transferred during COVID that they had written off, completely wrote off. So these kinds of experiences are increasing more and more. And I'm not saying that one has to be a clinician or a health expert, but you just have to, you know, you have to just stay on it. And then I don't think that people—
Well, Dr. Gigi, hold on for me 1 second. Hold that thought. I just want to say thank you to Waukesha because she did have a previous commitment, but she felt so strongly about sharing with us. She's there in Hawaii and she has a commitment this morning, but she wanted to come on before she go to her commitment. So Waukesha, we thank you so much for sharing your testimony. Thank you so much. You have helped us tremendously. And we pray the Lord's blessings continue to be over your life and your family and your new start in Hawaii.
Thank you so much for having me. Like I said, I am a big advocate for mental health and women's health in general. If there's one thing that I can say before I leave everyone is please be an advocate for yourself, use your voice. As women, we are told that we are dramatic Let them see you be dramatic, because when it comes to saving your life, there is no one who's going to fight harder than you for your life. Do not let anyone dismiss you. Even if it might be anxiety, you need to make sure that you have a full workup, because no one has x-ray vision to see inside of you to know what is happening to you. So please, I implore everyone, know your numbers and make sure you're an advocate for yourself. Thank you, everyone.
Yes, thank you. Have a great
Yep.
day. Thank
Thank
you.
you.
Thank
Bye-bye.
you. Okay, Dr. Gigi, go ahead, please, my love, and finish.
Yeah, I mean, these stories are so common that I'm wondering if, for example, through the church Temple of Praise, if we can't have people that are on call that folks can call. I mean, because this, I'm telling you, this is rampant. So that if some member of the congregation, has an issue, and we can all be on call just like anything else. You have a core group of clinicians that can be called to advocate. Because a physician or a nurse calling and having that conversation with somebody on the other end
Well,
makes a difference.
yeah, you saying something there, Dr. Gigi. You and I, we do so much with healthcare. We'll have to discuss that and, look at what that looks like. That maybe we can develop some type of hotline that we can advocate for others, because like you said, it's so common, and we want to sustain life that God gives us. And and if you don't, I want to say to you all women, if you don't know, you don't know, and it's okay. It's wise to ask somebody that do know. It's okay. You don't know, you just don't know. And that's what people are in place for who do know. We all have our different skill sets. We all have our different strengths. And when it comes to medicine, it comes to health, make sure you talk to somebody that, not somebody, oh, I know, I work. No, someone that is qualified, someone that know what they're talking about, and make sure you get to advocate for you, or at least to give you the questions that you should ask. Because then you could, get your little pad, write down your questions, and go and then ask. And Dr. Gigi, I mean, I already do this for some people. Some people who are close to me, they'll call me when they get to the emergency room. They'll call me. Like my godmother, she was just there, and they kept dismissing her, and she's 95. They kept dismissing her and saying she's old. So I kept calling them. I said, what are they telling you all? Let me speak to the doctor. And they said, well, they just keep telling us. I said, that has nothing to do with it. They still need to find out the underlying problem. Everybody, I mean, you say somebody 95, of course they, it may be 96. We already know that. But there's something going on. When you get older, when you get older, there's some things that's going to happen. So you don't want people to dismiss you either just because of the age. So you need to be there with your parents. Now we're going to take a quick, now for those that's going to win prizes, let me say this, disclaimer. If you didn't register, your name won't be here. So you can't win a prize, and you winning a prize because you're here. But let's see who's gonna win our first prize, Dr. Gigi. Let me share this screen. Y'all ready? Y'all ready? Let's see who's gonna win this first prize. Let me see. Can y'all see the wheel?
Yes.
Okay, let's see. Let's go. Let's go. Let's see. All right, let me see my wheel. It posed to.
I'm always a winner.
This girl wins every time. I tell you, I think there's something going on with the wheel. Oh, you here? Now you talking.
I'm always a winner.
Okay, now you talking. Now you. Oh, now you talking. But I mean, you winning a prize. You gonna show us your face. You
I'm
winning
back.
a prize.
I'm back here listening and taking notes to all this wisdom because I definitely do not want to end up in the hospital and they turning me around telling me, and that has happened to me before. Went to a hospital and was explaining to them my symptoms and they said, oh, it's just anxiety. But I always felt like it was a little more. So Dr. Gigi and Bishop Webb, you all are absolutely right. They don't listen to us. The only time that that a doctor paid me some attention was when I walked in because I just felt like my stress levels was extremely high. And there was a Black PA at the time. And she said to me, and this was the first time I had ever seen her, she said to me, oh no, you're under too much stress. And she asked me, you know, what were my jobs? What were the positions that I held? And I told her, she said, oh no, well, this is what I'm about to do. I'm going to make the executive decision and give you some time off and you can tell your job that I said so. She said, you a sister, I'm a sister, and we got to look out for each other. If it was not for her, I would have kept on going. I would have went back to work. And she said, you know, she ministered to me. She said, you got to choose you first. So even those moments when we are feeling bad, God always, as I'm listening to, I've heard this echo throughout the panel, is that God has been sending angels to say, oh no, wait a minute, this is what's happening. Oh no, I see what this is, versus somebody turning us away and we're actually leaving. So it seems like our lives have been saved by people people that God have placed in these hospitals and in these spaces to save our lives. And so I'm absolutely grateful that a sister looked at me and said, no, she actually said to me, do you have a vacation coming up? And I said, well, I'm going to visit my grandmother. She said, well, you're going to be off until you go visit your grandmother. And I took heed to that. And ever since, you know, I've been taking my blood pressure pill. I've been doing everything that I need to do to make sure, because it doesn't matter how small you are. Even the smallest of us can also have heart problems and diabetes and all those things. So even those who are small should definitely see a doctor, check your health. I had this thing with eating a lot of bread and I felt like, oh, it was okay because I wasn't gaining weight, but still those things cause cholesterol issues and all kind of different things. So we got to be careful with the things that we put in our body the older we get, because, you know, we're not as young as we used to be. We're all women of a certain age. And so we just got to be careful at the decisions that we make when it comes to food. And even taking on, I said to someone the other day, it's no longer a flex to say, oh, I'm wearing all these hats. I got 2 and 3 jobs and I got to run here, run there. That's not a brag anymore. At one point it used to be, that's not a brag anymore to be overworked and allow yourself to be overworked. So I stopped saying it and I also stopped doing it. I chipped away a lot of stuff that I would normally do. I just don't do it no more. I don't get involved. Yes.
It's called being wise. It's called using wisdom.
Yes.
And that's what we as women have to do. We have to use women. We have to, wisdom. And we have to realize we are not Wonder Woman. That's a TV show. That we don't wear a W on our chest because we are human. And you have to use wisdom. You have to take the time to sit back. You have to take the time. It's what I call your do nothing days. Even though our mind is constantly going, but you got to give your body time to rest, to relax, to recover, to recuperate from all the things you do all the time. Yes, I call it the do nothing days. I do, Dr. Gigi, especially since I had COVID. I had no choice. My mind was there, but I just didn't have the energy or anything. But have your do nothing days where you do absolutely nothing but lay in the bed. I don't care. You watch TV all day. That's your prerogative. You have to learn how to do that. Yes, Pastor Hillary. You got to learn how to do that. But as we get ready to do another prize, I don't know how you kill always Dr. Gigi. Every time I've done this, she wins the prize every time. I know what she gonna say is the favor of God on. I know that's what she gonna say.
Uh-huh.
I know that's what she gonna say. But look, ladies, we got a cardiologist, Dr. Reggie Robinson at Washington Hospital Center. We have a wonderful internist here, Dr. Gigi El Buyami. We call her Dr. Gigi, who is now transitioning to Georgetown. She was at GW for decades. She's now transitioning to Georgetown. So I want to make sure you have this information. And when she goes to Georgetown, Dr. Gigi, you're taking on more patients there? Okay, so she will be there. Go. Somebody put in the chat box, her husband needs a new doctor. You know, like I said, my bishop, he now sees her. My son, she's his doctor. Look, you got to get connected to great doctors. You have to, because we're trying to extend our lives. We're not trying to allow the enemy. Now the question is here, what insurance does Dr. Gigi take?
Good question, because I'm starting at Georgetown, I'm not sure. But it'll be through the MedStar system. So whatever MedStar takes, I'll be taking.
Right, so it'll be through the MedStar system, and I know that MedStar system, they take everything. They take everything. That Maryland, DC, Blue Cross Blue Shield, they take it all. MedStar takes so many of them. And that's really tremendous. That's a tremendous, tremendous blessing. And we want you to spread that word. You know somebody needs a good doctor. She's transitioning there to Georgetown. Then go there to see Dr. Gigi, and whatever she can address, she has some of the absolute top of the line professionals, specialists that she can refer you to. So we want you to do that. And don't feel bad about advocating for yourself. Now I want to say something about Mary. Mary when we look at Mary sitting up there. Now she don't look 25. I said her daughter look 25, so I gotta say she look 45. So at least I'm gonna give her at least 20 years. But when we talk about Mary, after I do this next prize, I want to hear you say, as an older woman, how did that impact you mentally? How did it impact you? You gone from having 2 feet and 2 legs to no legs and no feet. How does that impact you and having this triple bypass? So let's go for another round. Let's see if we can get somebody else here to win a prize other than Yukia. Y'all ready? Oh, wow. All right, we have Sister Shanita.
Hey,
Sister Shanita. All right, Sister Shanita still here?
I am Bishop. I'm
Okay,
here.
love. Okay, well, we got somebody other than Yukia. Can we see your pretty face, or you gonna be like Yukia?
No, I'm here. I
I
have this
oh, there you
background
go.
light, so my
There-
video is a little off.
there-
Sorry.
Well,
background light.
yay,
Hi,
yay.
praise God, everybody. Hey, Pastor Carla.
Okay,
Sure.
love. So you don't want the prize. So your prize, I gotta tell Deaconess Yukia offline what she gonna win. She's always winning something.
Okay.
But the second prize, well, you the first lady now. You the first lady, the co-pastor, and all this other stuff. But we got for you a free cookbook. American Heart Association, all kinds of good meals.
I'm sure my husband will love that.
Huh?
I said, I'm sure my husband will love that. More reasons
Well,
for me
see,
to be in the kitchen.
We aim to please. We aim to
do.
please.
We do.
We aim to please. So we're gonna get First Lady Roy, we'll get her address. I have Deaconess Shakir, so we can give her the gift, and we're gonna give away one more prize. So hold on, you might get that third one. You might. I didn't put me and Dr. Gigi on there. We don't get a prize. But and then I want you ladies, if you have any last minute questions, type it in the chat. You got one for Dr. Gigi, type it in the chat so we can then help you and answer those questions. Now, Murray, speak to that for us, because I think a lot of times with younger women, we really get a little nervous. We thinking, wow, I get older, is that gonna happen to me? And how do you navigate life? Now you have no feet, you have no legs, you had triple bypass surgery, you're older, it puts you in touch with mortality. How does that make you feel?
At first, it made me feel some kind of way, but then I looked at the whole picture. Even now, I can still feel the pain in my chest from this heart surgery. The bones is still sore. My limbs are still sore. I'm in pain 24 hours, pretty much. I go to bed in pain, wake up in pain. So I guess my body just has gotten immune to it. As far as me getting around, I pretty much try to stay gone. I have gone through about 6, 7 manual wheelchairs because I don't be still. And so I was trying to get Medicaid to pay for my chair. They told me I wasn't due for no chair until 2025. Not knowing I'm not the average person in no chair. I'd be in that chair all over the place, Maryland, DC, Virginia, where you know, Bishop, I stay gone. So at first, the stares, you didn't mind the children, you know, staring at you, but then you had grown folks who would just stare me down like I was from another planet somewhere. That bothered me, but that was in the beginning. But that don't bother me now. You know, children, you know, their parents be snatching them back. So I say it's okay, let them ask questions. They were, what happened to your feet or whatever? But that don't bother me anymore. I thank God every time I can get out that chair, climb in my bed. It's pain climbing in, climbing out. Wheel, get in that chair, wheel around there. I can transfer, get on the toilet. I can get in the shower, do all of these things that everybody else can do. So pretty much. And then even at certain events, probably think this is funny. I always had my own chair. When they be pulling out chairs, trying to find another chair for somebody, Mary be already sitting in hers. Like I said, back then when they had to do their second amputation, take the feet, but leave me, you know. So it's almost 5 years. And so pretty much the shoes I do miss because I used to love buying shoes. And I don't buy them for me, but when I see them, I buy them from other people. So life is just what it is. And so also, you know, when you do things, there are repercussions behind things. You do things and you know what comes with it. So I know I did a lot of things that I didn't have no business doing as far as my health and was still doing, you know. So, but I never felt like I was dealt a bad hand or anything like that, because I guess they give you lemons, make juice with it, keep it moving. And I'm just not missing anything. It's like I have been doing more than what I was doing when I had my feet. I haven't been places I've never been before, you know. So yeah, it was in the beginning, it was a new norm for me,
Well,
my daughter, and you know, my family. When
yeah.
I first got out of the hospital, my daughter and her husband Jay, they took me in the first year, and my hospital room was their living room. My hospital bed, everything was set up there. So, and I was surrounded with people, you know.
Caretakers.
Yeah, and so from day one, because even when I was in North Carolina, this little girl, she stayed there, you know, bought her laptop, was at with me every step of the way. And today, still the same thing. So I'm not really lacking anything, you know.
Yeah.
God has been good to me.
Well, we want you to know today, Sister Murray, and I think I speak for all the women, and they could put in the chat as well. You are an inspiration. I mean, to have lost a daughter, to have triple bypass surgery all in the same few months, to then lose toes, to lose feet, to lose legs, all of this happened to you in the past 45 years. I mean, you and then sit there looking pretty. You're looking better than all of us. I was trying to put on a little big earrings, but look at you. You up there, you got on some bling blings. Look at that Pastor Coach. You know, we try to come on here and look a little bit. You up here with the turban on and your earrings, I mean, and your red lipstick, you know. So I just want to say to you, we are so grateful today that you shared your testimony with us. And it's just been such an inspiration. And especially to us who know people or have people in our family with diabetes. And of course, Marnell is there. I ain't need to put her out there that she cooks and all that, because she probably say, Bishop, I'm just too busy. You know, still I ain't got my salad yet. I've been waiting on my pasta salad for 8 months. I ain't got it yet. But you know, Marnell is just a tremendous, I want to say this on a serious note, she's a tremendous daughter, because when you were there in North Carolina, she was constantly calling me. She was working. She had a lot. She was a wife. She had a child, trying to prepare for college, getting out of high school, all of that. But every step of the way, she has been there for you as an advocate and taking care of her mom. And so as women, we want to salute you and your daughter and say thank you. Thank you. Thank you. We want to salute you. Thank you for showing us how it's supposed to be done. And that's what we're supposed to do. All right, let's get our last prize. And then I'm going to give Dr. Gigi something to say. And let me see who's going to win this last prize. Y'all ready? Y'all ready? Let's see who's going to win this last prize. Oh, no, we can't have you, kid. Yeah, we can't. No, 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 you can't. I need you to stop sitting over there praying that your name come up.
Favor, not fair.
Yay! We got one for Mary. It ain't fair, babe. It ain't fair. It ain't fair. It is not fair. Favor is not fair. Well, we have Sister Murray. Sister Murray got a prize. Yay, y'all. That's great, ain't it? One of our panelists. And let me just say this. I know Deaconess, you care. If I would have let her name go the second time, she would have said, Mom, just give my prize to somebody else. But to Sister Mary, we have a gift card for you. We have a gift card for you. And so you can eat something healthy. So you can eat something healthy. Thank you so much, Pastor Hillary. Okay. Now, thank you so much, Monty. I'm so proud of you as well, Big. Now, Dr. Gigi, now ladies, Dr. Gigi has challenged me. Let me tell you something about her. She got me running all over the place. We do all kinds of things for health disparity. We're everywhere. We were part of the team that now we finally are getting a new hospital in Ward 8. The Rodham Institute, I want you to look it up, the Rodham Institute. She's moving it now to Georgetown, the Rodham Institute. It was GW, the Rodham Institute. But stay in tune with us in our web pages with the Rodham Institute and Deborah Webb or DK Webb Ministries, because you'll see a lot of times we're doing things all the time. Some things we don't do like this. I just did this because God told me to start doing it every year during the Wear Red Day, which is in February. But we have a lot of events, and so you can come to them. Dr. Gigi does a lot of things. She's on CNN. She does a lot of times. She's a guest on CNN. She's a guest on many of the mainstream media on television. She's a guest. She's giving out information. She's sharing information. And again, beloved, if you need a new doctor, Dr. Gigi is transitioning to Georgetown. A cardiologist, Dr. Reggie Robinson. Your mother, your father, your husband, your sister, your brother, anybody you know, spread the information. I've always been one, I like to give free information. Spread the information. We ain't got to be so deep and wonderful. Spread the information so we can live and not die, okay? Now, Dr. Gigi, I got people on here saying, thank God for you. They say they going to Dr. Robinson. I love you more. I love all of y'all. I'm glad it's been a blessing. Dr. Gigi, what can I pay you? I can't afford it.
Bishop Webb, let me just tell you, you pay me by your love. That's all I need. That's
Yeah.
to me the most precious and the
Yeah.
most valuable. So I just want to say thank you to all the ladies. Ms. Mary, you have inspired me at the very beginning. I said that I'm a student. I've learned a lot, and I appreciate your sharing your story. I just want to say one thing. Please don't forget to get cancer screening. Because when one has a lot, particular medical problem, sometimes you let other things fall off. So as a
Okay.
2-time cancer survivor, I had breast cancer and kidney cancer. Don't forget that. And
Don't forget
remember, and I say this as somebody of Egyptian origin, you are queens. You come from civilizations, which, I'm not a member of the African diaspora. You are beautiful. You are incredible. Your leaders, your mothers, your aunties, your wives, your sisters, your granddaughters. And I believe that women are going to make the difference in turning this world around. And I'm also on blackdoctor.org. I have a show every other week. So please join. And it's a great not organization, it's a platform that you can join. There are all these wonderful programs on a variety of topics. So we have one coming up on February the 23rd. It's virtual and it's about mental health. So please join us. And I hope to be able to meet all of you in person. Love you all.
yes. We love you more, ladies. Now I did have that's what I need you to do, because y'all pray for your girl here, because next time I'm gonna have me some help. But I had created this poll, and did it help you? So I see some comments there. Just do me a favor. Put in the chat box, on a scale of 1 to 10, how awesome was this for you? How awesome was it for you? And did it help you? All those factors on a scale of 1 to 10. Was this helpful to you? And maybe Dr. Gigi, I know you're saying you'll get to meet them in person. You all know, for those that know me, we love health. That's our life. We're gonna have something where we can come together physically. And then you can come and we can have a panel as we've done before. She and I has done this so many times, but we did a lot of it virtually when COVID first started.
Mhm.
But we'll have a panel and we'll have people there, and let's discuss it, ladies. Let's keep each other encouraged and let's stay heart healthy. Keep your heart healthy. What, Dr. Gigi, I want to recap. Remember, go find out your numbers. When you get your physical, ask them to get your A1C as well. Ask them to do your lipid profile, your fats. Find out what your cholesterol and all of that, your triglycerides. Because some people just say, well, your blood is okay. And so we just leave and say, oh, they say my blood is okay. But that's because they don't check for everything. They need to make sure they check your A1C so you can start keeping a baseline of what your A1C is. Dr. Gigi, that's how I knew to advocate for myself. When I had COVID, my A1C started going up. And I said, something is wrong. Something is wrong. So you got to know your numbers. Yes, Dr. Gigi, know your numbers. That's for your parents, your husband, your children. Even. Know your numbers. Secondly, what we can't stress enough, self-advocate. Don't let people dismiss you. Dr. Gigi gave us an excellent advice. If they don't listen to us, call somebody on the phone and say, and don't ask them for permission. Call somebody on the phone while you're there with them and say, I need you to speak to them. Or I got them on speaker. That's what my son does. Every time my son needs to take my grandson to the doctor, calls me on the speakerphone. Mom, I'm in here with the doctor. And I talk to the doctor because it does, beloved. It makes a difference. When you have health professionals that know the language, that know what to ask, it makes a difference how they treat them. So don't feel bad. Self-advocate. Self-advocate. And most of all, we want you to live. We want you to live to stay healthy. And then Dr. Gigi is telling us, go to American Heart Association, do your cardiac risk assessment through that calculator. Do your risk. Go to the AHA, wonderful site, plenty of resources there because that's what I was going to tell you. All kinds of stuff there. Menopause, the cardiovascular risk, all kinds of things there. Get involved, Dave. Let's get involved. Hey, Dr. Gigi, you know what I was thinking of? Marnell is this exercise. I can't keep up with it. I can't go out there and go in the parking lot and do all that. After COVID, I can't do that. I can't do all that. But maybe Dr. Gigi and we can get Marnell included. But one day we can even do a heart walk. We can do a heart walk. We go out there, ladies, put on our red, do a heart walk, and then we come back and we convene and we talk and we share. We got to start getting active. We got to start supporting one another. We are our support system. And today, Dr. Gigi has given us as a board certified position. She has given us as one who has been practicing for almost 40 years. She has given us sound counsel and advice, and her testimonies from Murray Stoops. I've always called her my Shiro. That she and I came up together. Every time I go see her, Dr. Gigi, she encouraging me, and I'm up in there about to cry. I'm just saying, okay, I gotta keep myself together because she my Shiro. She is absolutely one of the strongest, most resilient, most thankful, most humble women that you could ever meet, having suffered all she had. So again, to you, Mary, I love you. You know I love you. I love you much. You my Shiro. I always say that. I always say that. So women, if you want to be a part of our heart walk, drop Bishop DK a note. Drop me. Okay, I'm seeing Dr. Gigi. I guess you can see the comments too, that people love this and people want to do this, and they, who's this? I got location in Southern Maryland. Okay, I got tens. Okay, that's wonderful. People going to see Dr. Robinson. So that's wonderful. Thank you so much for your feedback. Now, for those that won prizes, First Lady Shanita, I need you to inbox me your mailing address where you want to send. And then Deaconess, you
Bishop, I have to run, so I'm gonna say
okay,
thank
we're getting
you.
off. We want to say thank you. We're getting off now.
Thank you so much. I love
Yeah.
you all.
We love you.
Thank you. Bye-bye.
Bye-bye. Deaconess, you here? Please inbox. All right, go call me. Ladies, I love you. Let's close out with prayer. Master, we thank you now for all this wealth of knowledge and information today. Bless my sisters, everyone under the sound of my voice, God, even those who will go back and watch. And Lord, continue, God, to give us wisdom, give us understanding, enlighten us, God, how to take care of this one body you give us and protecting our hearts, especially as women and women of color. Do it for your glory, God. We pray now that you bless Dr. Gigi for giving us this free time, God, for sharing her knowledge. We pray, God, for our two that are survivors, Murray Stoops, God, and Waukesha Stewart. We pray, God, you continue, God, to strengthen their hearts. Do it for your glory. In Jesus' name we pray. Amen and amen. All right, God bless y'all. I love you to life. Y'all have a wonderful day.